Good afternoon, everyone. Welcome back for our afternoon session. To introduce and moderate the President's Panel, please welcome immediate past President of the American Academy of Pediatrics, California Chapter 2, Dr. Alice Kuo.
Thank you so much. I have the immense pleasure of introducing our very esteemed President's Panel. Directly to my left, Dr. Carol Berkowitz served as the president of the National American Academy of Pediatrics from 2004 to 2005. There are long lists of accomplishments for each one of our speakers. I'm going to cut to the chase and just list their interests because in the interest of time, I think you'd rather hear from them. Dr. Berkowitz's interests have focused on women in medicine, medical education, pediatric emergency medicine, and child maltreatment. Dr. Colleen Kraft, next to her, served as president of the American Academy of Pediatrics from 2018 to 2019, is that correct?
Yeah, it became calendar year after
right,
a while,
so I think it's a little confusing.
I forever.
Her interests include the financial model for social determinants of health and population health data-driven quality improvement initiatives. And our current national AAP president, we're so fortunate to have here in our local area, Dr. Moira Szilagyi from UCLA. She's currently our national president, and her interests include medical home for children in foster care, vulnerable children, and child abuse and maltreatment. And so to kick us off, we have a very broad expanding question, and each one will comment for about 10 minutes. The question is, following the COVID-19 pandemic, many threats to child health have become more evident. Glaring disparities, worsening mental health issues, and a growing anti-vaccination movement, just to name a few. Does history repeat itself? For Drs. Berkowitz and Kraft, what similarities do you see with the threats to child health that were present during your time as AAP president? And for Dr. Szilagyi, as current national AAP president, what are the greatest threats to child health today? I turn it over to Dr. Berkowitz.
Oh, okay. So for me, one of the big things back in 2004, 2005 was the threat to Medicaid. And it was time for reauthorization of what was then called S-CHIP, which was now CHIP. And so at that point, and so that's perennial. There's always been threats for funding for children's health. So the Academy was focusing on putting forth principles about access to care. I know it may seem like, what? Aren't there principles? But it wasn't delineated. So there was a subcommittee on access to care. We put things together, and we wanted to get buy-in from other professional organizations. So we decided to meet with the AMA. And the AMA was having its advocacy meeting in Washington. It was March. And we were going to meet with them to see if we could get them to support S-CHIP and our principles. So it was inauspicious to start with. Okay. I was taking a 4 p.m. flight from LA to Washington, taking that flight before it gets in around midnight. We were meeting at 10 a.m. Plenty of time. So I get a call at the airport, and they want to meet at 8 a.m. Still, I could do that. I was on every other night as a resident, so being up all night is not a problem. Okay, my flight gets delayed because of weather in Chicago. Okay. We didn't leave at 4, we left at 8, and I got in around 3 in the morning. So check into the hotel, and they say, please call the person who was like a lobbyist then. I said, I'm not going to call him at 3 a.m. He said to call no matter what. I called, and he said, we're meeting in the lobby at 6 to plan our strategy. So it's like, I'm cool. Maybe I won't take my clothes off. I'll just lie on the bed for a couple of hours. So we get down, and it's myself, someone whose name was Graham Newsom. He was like lobbyist, and Errol Alden, who was then the executive director. And we're planning a strategy. And then we get in to the meeting, and it's all the people, the president, the past president, the future president. There were about like 12 older Caucasian gentlemen around the table. And before we said anything, they said, you pediatricians better get over it. Things are changing. You can't have the status quo anymore. And I could feel my neck getting all blotchy and my face getting blotchy. And I think God spoke through me because I said, we know they're changing. And I know not a single one of you would ever want to hurt a child. And we're here to ask for your help. And it was brilliant. Well, it wasn't me that was talking, blah, 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 blah. And as a result, they signed on to everything. They signed on to reauthorization of SCHIP. The only thing was the entitlement. They wouldn't sign on to EPSDT as an entitlement. So EPSDT, most of you would know, it's early periodic screening diagnosis. And the big thing was the T, because the T was treatment. And if you diagnosed a condition using that, it was paid for. It was paid for by Medicaid. They wanted to get rid of the T in EPSDT. So we left that meeting with a lot of support, and the headlines on the New York Times was AMA supports $60 billion in reauthorization of CHIP money. And you know what people in the academy said? Why didn't they say the academy did it? Well, it's not news when pediatricians, rally in support of children. It was getting the buy-in. So, I mean, I think we're still facing access issues, a subspecialty act. Just look at mental health. What was the figures about, less than 50% of adolescents with mental health issues have access to care. And I have to look, make sure, because I could go on. I'm still, 3 minutes. Okay, so I'll bring up the other thing. So, we've been worried about a lot of things with COVID, but as a child abuse pediatrician, yes, Claudia, one of the things we've been worried about is what's happened during COVID. And there were predictions about increases in child abuse. But the data don't support that in terms of reported cases. Reports have gone down, but maybe it's not a decrease in the incidence, just a decrease in reporting. And 20% of reports come from the school. So if the children aren't in school, a big source of the reporting is missing. And they're not seeing their pediatricians, right? So that's also an issue. So you know what, it's like Jaws, just when you thought it was safe to go into the ocean, there remain challenges.
Yeah, my recollection during your presidency actually was the first year that I was on an executive committee for community pediatric training.
Oh, right.
And it was true, like when you talk about all the fights for Medicaid and access to care, that to me was the predominant role of the academy at the time, was access to care for children. Catch was big, Tom Tonage's, right? Like that was what was going on during that time. And I think it's because of the work of the advocates and the pediatricians during that time that we can now do more work around social determinants and immigrant health and some of these newer topics. But back then it was just basic access to healthcare.
Right. The other challenge is that there were things called state planning amendments where individual states could sort of opt out of Medicaid and just get lump sum money. And I remember in West Virginia who decided, you know what, we're going to penalize families that don't get their children immunized. If you didn't get your child immunized, you're losing your Medicaid. Well, who did that hurt? It hurt the kids. It made no sense. So we had a lot of battles then to assure access.
So fast forwarding to Dr. Kraft's
2018.
time. Yeah.
And very interestingly, the relationship between the AAP and the AMA has only really gotten closer. I remember your predecessor, Dr. Willett, who made the comment once that the AMA and the AAP are like a loveless marriage. We only stay together for the kids, but they don't do that anymore. The AMA is really, they're really on board with lots of topics that regard child health. And one of the big ones I ran into was immigrant child health. So it was great hearing Dr. Ibrahim's talk this morning. I happened to become president-elect just as Donald Trump was becoming president of the United States. Very interesting times. So we really had a lot of child health threats going on at the time, but none was really bigger than the whole racist bigotry, terribleness to immigrants and immigrant child health. And one of the things that we heard about from our colleagues in Texas is that children were being separated at the border when they arrived with their parents. And parents were coming to the United States after having this arduous, long journey and all kinds of violence in their home country. And parents were telling us we'd wake up in the morning and the family next door to us got machine gunned down. And so we had to leave. And what was happening is that we were then traumatizing them by taking their children away. And the rhetoric there was that these people are felons. We have to take their children away. That was the zero tolerance policy. And that was the idea behind the zero tolerance policy. And so what we did was, first of all, went to talk with our Republican colleagues. That went nowhere, absolutely nowhere. So then what we did is let's do some on-site look and see what's going on and use our voice to advocate for these children. So I went down and spent some time in a tender age shelter, which were for children ages 12 and under at the border in Texas. And the first room I went into was the toddler room. You have been in a room with 15 toddlers. They are loud and rambunctious and moving around. And these kids were quiet. I mean, silent, except for one little girl who was just crying and sobbing and beating her little fists down. And the people in there were really, they felt really badly. They were trying to give her toys and trying to give her books. And she kept on crying. And we all sat there and knew that what these kids needed were their parents. We couldn't help them. We couldn't give them what they needed. And that really personified what we know about adverse childhood experiences and young children and toxic stress, which are these stressors that when you don't have that buffer to help you through those feelings, it can cause increased cortisol, epinephrine, fight or flight hormones, and cause decrease in synapses and language and social emotional bonding and brain damage. And so I wrote an op-ed that appeared in the LA Times, May 3rd of 2018, talking about separating parents and kids at the border was the last thing we needed to do, and actually coined the term government sanctioned child abuse. If you have heard that anywhere, it came into that op-ed. And that was really AAP supporting this. So fast forward a couple of weeks, I get this call on my cell phone, and I missed it because I was seeing patients, and I went and checked it, and it was Oprah. And I have the call. If anyone wants to hear it, I will play it for you. But she wanted to know what she could do. And so she got me in touch with Gail King at CBS This Morning, and we went down to the border and recorded a session in front of the Ursula Processing Center where kids were being separated from their parents, and talked about toxic stress and talked about what we were doing, the harm we were doing to these very young children. That set off 55 interviews that week and really mobilized people across the political spectrum. So we had Laura Bush out there saying, you cannot separate these kids from their parents. And by the end of the week, the zero tolerance policy was formally pulled. Now, we know that kids were still separated. And we know that even into a different administration, we have things like the Migrant Protection Protocol, which is kind of a joke because it's anything but protection. It is remain in Mexico. You come to the border, you claim asylum, you get sent back to Mexico where there is no protection. and that's still happening even in the Biden administration. It has not been changed. The other thing that hasn't been changed is the whole idea that, we have to keep these people out because of COVID, when what we knew is early in the pandemic, we were actually exporting COVID back to Guatemala and Honduras because we would have people in family detention and other detention and deport them, and they were bringing COVID back to Central America. So we still have a lot of threats that we have to work with. But what's come from this has been, first of all, standing up for kids. Secondly, doing things with our advocates on what is the best way to approach refugees and migrants in our communities, and to really make this a very practice-based, practical approach to caring for children in our community. And even as we go through and go forward, we have resident projects that are really focused on immigrant child health. And in fact, the thing that really hit me at Children's Hospital Los Angeles were the number of our residents who they themselves were refugee and migrant children. And so these people are not these people, they are our patients, they are us. And to really move forward on that and have the AAP celebrate that and move forward with it is really important. One last thing that actually increased during the pandemic that we heard less about, but was really important, was vaping. So that was a big deal in 2018. And the idea that we could not get the FDA to say, okay, tobacco companies, take the flavors out. What kind of self-respecting Marlboro man is going to give up his smokes for gummy bear flavored e-cigarettes? Nobody. You are targeting children. And so what the AAP did was they actually sued the FDA, basically to say, do your job, get these things off the market. And for a while, we actually did win that lawsuit, but things keep creeping back, and you can't go to anywhere within a children's hospital and not find a vape shop where you can get cotton candy and blue raspberry and what other flavors. And we know that kids increased vaping during the pandemic. So this is going to be one of those ongoing changes. And we have our battles. We keep our eye on really keeping kids safe, and we have to keep working. Laura.
Thank you. I just wanted to give a shout out after that. I mean, those are still threats to child health today. Because of what happened in 2018, Lisa Gantz and Cyril Shaw started our Immigrant Health Committee, which continues to be so active, and sponsored Dr. Ibrahim to come speak today. And then I also wanted to give a shout out to the anti-vaping champion table that the California Department of Public Health gave UCLA a grant in order to address vaping here in Southern California. And to be honest, I think the pandemic, many people feel that vaping rates went down during the pandemic. It's hard to say. The Department of Public Health thinks and suspects that they're on the rise, and that many cases of COVID in young adults that ended up in the hospital was from undiagnosed or unidentified vaping or EVALI. And so they're doing some studies to look at that. So those are definitely ongoing threats that we still see today that had their origins during Dr. Kraft's presidency. So Dr. Szilagyi, now as current national AAP president, coming off of a 2-year pandemic, what do you think are the biggest threats to children's health today?
Thank you, Alice, and thank you to the two people whose big shoes I try to fill here. I think if I had to say one word applies to all the stuff that we're working on at the AAP at the national level right now, it would be equity or inequity. And I think we can group all the topics that have been covered so far under that. Certainly child mental health, trauma-informed care, immigrant health, Medicaid reform, certainly all come to mind under there. Our big child health priorities this year are COVID-19, mental health, and equity. But I actually think we need to put equity either as the foundation or as the top. And we are still advocating on all the issues that both Colleen and Carol dealt with during their tenure. And I will say I am deeply proud of the AAP because the AAP stands on principle and ethics and science. And it really puts the child and the family at the center of everything we do. along with the pediatricians who are our members. So, and the reason I put inequity first is because, for example, with Medicaid, after how many was 1960 something, Medicaid came into being. We are still looking for adequate payment for care, just for routine care in many places. We are looking for parity for mental health care. There's a state match that burdens poor states, so they can never achieve matching benefits to some of the richer states. And a resolution came up at the annual leadership forum in August, and it was that the Academy really needs to address the federal state match, because we probably just need to federalize it the way Medicare is federalized. So there is going to be a big push this year on Medicaid reform. And EPSDT benefits vary from state to state, even though it's technically a federal benefit, because different states afford different things. And as Carol pointed out, treatment suffers the most. We're pretty good at diagnosing kids if they get into our offices, but it's often hard to find them treatment, in particular mental health treatment. And so to my mind, that's just a large, huge inequity problem. And as we all know, that burdens some populations more than it does others. And 54% of the children in the country now are covered by Medicaid and CHIP, which means 54% of the children in this country are poor. So we have a lot of work to do in the United States. I'm an immigrant. We came to this country looking for a better life. I have a much better life than my parents did, but I look around and I know the neighborhood where I came from, and I don't think things are a lot better in that neighborhood than when I left that neighborhood. The other area for me is mental health, and that comes out of all my work in foster care over the years, seeing the burden of trauma in the lives of these kids. I'm a big proponent of trauma-informed care, which I think should be universal care. We have a lot to do around training and education with respect to that. But the burden of trauma, we know through toxic stress physiology, leads to poor health outcomes over the long term. But what we tend to see in childhood, the vast majority of what we see in childhood is developmental and behavioral and emotional problems. And it's really up to us as pediatricians to identify those families early, to identify those children early, and get them into the services they need. And a lot of it can actually be done in the primary care setting. And then we of course, need to get paid for that. That's the other large inequity. We often don't get paid for a lot of the behavioral health stuff that we do. Immigrant health, even last summer, I went with the current president then, Lee Beers, and Sally Goza, who was the immediate past. And we went with some people from the DC office to the sites here in Los Angeles. So we had set up 2 emergency intake units, not we. UCLA had one down in Long Beach, and the other one was out in Pomona. And both Sally and Lee had been to the sites that probably Colleen had visited during her tenure. And the sites here were actually really set up to be child-centered and trauma-informed. And both Lee and Sally kept saying, when pediatricians get involved, things get done right for kids, because it was apparently just night and day in the difference in care. And so while I hope that we never need another emergency intake shelter for unaccompanied refugee children coming across our borders, if we do, I think we were able to teach the federal government a lot about how to take care of children. And those children also come in with huge trauma histories. And now this, the other big burgeoning issue this past year has been transgender health issues. And this just erupted again in Texas. I know there's so much news right now that it's easy to miss some of the stuff that's going on, but Governor Abbott and his Attorney General, Ken Paxton, have basically declared that gender affirming care is akin to child abuse. And he has directed his Department of Child and Family Services, or what, I don't know exactly what they call it in Texas, to investigate those providing gender affirming care, referring kids for gender affirming care, if you even just know about it and you're a mandated reporter to report it. And so we did publish a opinion this week, again, calling that out as, first of all, it's not based in science, it's an interference in the physician-patient-family relationship, and just egregiously wrong, that we really have to offer care to all children equally, and we have to affirm the value of each and every child. So there are countless issues that seem like they still have a theme going on all these years. I will say that one doctor in Dallas told me yesterday that there was a multidisciplinary clinic for gender affirming care in Dallas, and it disbanded last November because the physicians and the families who came to that clinic were receiving death threats. And so this is an issue that I think that we as pediatricians are just absolutely obligated to speak out about. We have to kind of change some hearts and minds. Thank you.
Yes, well, thank you. We still have a few minutes if there are any questions from the audience for our very esteemed panelists. Well, while we're waiting, I thought of one. If you could name one thing, one vision for the future, one hope that you have for the Academy, what would that be? Yeah.
Well, I guess Medicare for kids, it was all in place. It was called Medikids. We had it all lined up. It happened at birth. There were no requirements. And as soon as you were born, you had health insurance. And so that we get that through. It's only like 20 years that we've been trying. So maybe this will be the lucky year. So that would be it. And that wherever you went, you could get health care. It's not like you come in to be seen in the clinic at my hospital and I'm sorry, you don't have the right, your LA Care non-DHS, I can't see you. That's the stupidest thing. We have good health care, but a really rotten healthcare system. You can quote me on that.
I was thinking very much along the same ways, is that children receive care where they need to receive it on the ground. I feel very, very worried about our private practice pediatricians and those who are not associated with a big healthcare group, because they really are doing a lot of the bulk of the service for families and children. And you want to keep them in communities. You don't want to have everybody travel to an FQHC or an academic center and have to call 1-800-GET-LOST instead of just calling the number in the office. So I think that my vision would be that we support our pediatricians wherever it is that they want to work in whatever communities they want to work in.
And I completely agree with both of those. I think in the world in which I live, that we would have a bigger voice in those upstream issues that really affect children's care. The bulk of health issues that develop later in life are not because we've not provided good health care when children are young or teenagers. It is because of all the things that happen outside of the healthcare system. It is the poverty, it's the racism and the discrimination, it's the bullying, it's the community violence that children are exposed to that change their underlying physiology and lead to poor outcomes. And that also affects many aspects of their health. They're much more prone to get cardiovascular disease and certain types of cancer and inflammatory diseases. I had a young person in foster care I happened to be on a bus with for some reason. And he was saying to me, why is it that so many of us who graduate from the foster care system end up having things like lupus? This is about 5 or 6 years ago. And, you know, all I could say to him at the time, it's because of all the stress that you've had in your whole life. It's like not your fault. It's not anything you've done. It's what's happened to you in your life. And then I was thinking, what am I doing as a pediatrician to intervene in that? Like, it made me start, you know, re-questioning what I do in my office every day to take care of the kids that I serve of, and could I do it better in some way? So I really do think that we have to do a really great job of educating and training our up and coming medical students and residents to engage in this work, to be out in the community. So much of that work gets done through our advocacy, and I would, the AAP is richly and deeply involved in advocacy, and I just want to see that continue with Robusto.
Great. Well, thank you so much. On that note, thank you so much for our panelists and for their thoughts and their wisdom. And, you know, the future is bright with the Academy for Children. But I encourage each one of you to get involved in the ways that you can, either locally in your practice or more formally within the Academy, because I think this is a great organization for us to advocate together for children's health. Thank you very much.
Thank you.